what do we know about the efficacy, the quality of the health services, and the protection offered to children when they're in a vulnerable position here in the province of Quebec? We know what we should do, but we don't do it. We all love our children. Everybody says so. We all say we love our children. But collectively as a society, we say we're nuts about them, right? We hear about that in French, on les fous de nos enfants. We're nuts about our children. We hear that bandied about. But as a society, it seems to be a desire, but is not reality. In fact, we've signed the Convention of the Rights of the Child. But we haven't in reality applied these rights. Adults know of their rights, but if we ask them what children's rights are, they won't be able to answer. 35% of the children in Montreal are not ready for school. And 30% of the children are sexually abused, which means that in the population in general, some 30% of the population is not fully capable of going forward because of their path, because the development has been perturbed. Their brain is not developed to its full potential. I don't know how a population or a society can grow, can develop without the full cooperation, full participation of 30% of its population that is not involved. I wonder if perhaps one could broach the care given to these underprivileged children by working on an economical model. The politicians speak to this. You can hear the different politicians, different parties talking about interest rates, tax brackets, all sorts of schemes, financial schemes pertaining to the economy, but nobody will speak about what's behind this economy, the underpinnings of the economy. And the answer to that is the capability of a population. If Air Canada had 30% of their planes crashing, they wouldn't be in business for very long. And our population has to continue to work without the participation of 30% of its population, so 30% less capacity, so the economy won't be able to function properly. If we considered our children as the most important raw material, not oil, not uranium, not iron, but our children were the most important element of our society, we would then see that this raw material, quote unquote, is renewable, has multiple capabilities, highly diversified, non-toxic, to boot, if we take care of their development. The challenge is to make sure people are aware of this reality, and that the political class understand this and may act accordingly. If we have a couple of dozen children in the province of Quebec have the chicken pox or what have you, there's a panic, or smallpox, and then throughout the Quebec network, there's a possibility of getting your child immunized, vaccinated. well, we have a much greater number of children who are in dire need of services and do not have access to them. We know that there are some 200 communities in the province of Quebec that have the need for social pediatrics within a community. The resources are there, but the interest isn't there to share all of this capability throughout the territory, to reach out to those children who have difficulties with respect to their development because of the environment in which they were raised. So if we take a look at all these elements together, perhaps an economic model could be built with the involvement of what Dr Julien has come up with, based on that is evidence-based, for instance, and also what we know from the States. The cost is from 1 to 16. For each dollar invested, you'll get 16, but not in the first electoral cycle, right? Obviously. But politicians really have to take a look at the long term, not only the 4 years ahead of them or the upcoming election campaign or cycle. So that's the challenge that we have ahead of us. This is what we have to look at. We have to make sure that the entire population can fully participate. Thank you. Thank you, Nick. I'll ask Nico to take the floor then. To follow up on what Nick has just said, yes, there is a challenge with respect to access. We have to find out more about who is receiving the services, in what circumstance, and to maximize those resources that are available. And already there's a huge gap, shortfall. There's a piecemeal approach of services and approaches. We don't know much about who is benefiting from these services or not. How are these services being distributed? And the distributed isn't broad enough as compared to the resources, but we don't even know who are the recipients and in what circumstances. Generally speaking, what we do see is that the best organized families, those families that have access to the resources, have the best access to the service. In a situation where there are many services, or in a situation where there aren't enough services, it's essential to make sure that those who have a need for them do have access. Then there are other obstacles that are either brought forth legally or because of professional culture that make it such as coordination, cooperation become a problem. On our side, research takes a close look at child protection, but it's also a file where we see the impact of this piecemeal approach. And it's very clear to us to see to what extent the definition of the problem ends up limiting the services and the possibilities for cooperation. Specifically in terms of child protection, one of the problems is that all form of communication between professionals becomes practically impossible. There are services where they can receive information, but there's no share. From the get-go, this is not a good way to start. These services determine the first contact surrounding the family, but the whole definition per se is extremely negative. So once again, it's not a very positive start. This leads to frustration, but not only frustration, because we think of the organization of these services and access of these services in a more business-like approach. What's more frustrating then is to realize that there's no accounting and no proper perception of what's going on in the long term. And what we're able to see on the government side of things is that they are incapable of specifically describing who is benefiting from these services, what is the journey of the different families or young people who benefit from these different systems, but also these families are constantly being confronted to these revolving doors. So there's on one side, the need for us to be more responsible with regards to the distribution of the resources, but also one must pay attention and deal with the hurdles that are preventing cooperation, collaboration, and preventing an approach that takes into consideration the fact that problems never come in isolation, but are problems that emerge in a much more broad context. This is one of the reasons why we are particularly interested in the social pediatrics style or mode, this single wicket, one-stop shopping approach. You start work with one child, one family. You don't define or limit the services with respect to one specific problem. Yet again, another one of the challenges. But there is hope with the possible reorganization of services. Well, I never believe in any type of quote-unquote reorganization, to tell you the truth, but I hope that this quote-unquote reorganization will occur, will unfold with the family at its center. And with an elimination of the hurdles, the barriers, the roadblocks that prevent any type of cooperation and that lead to a better access. So what do we know about access to services? We know very little. That's one of my answers. And we're not at the position where we can give a specific answer having to do with the eligibility criteria to a particular service. We don't have an idea of the global experience of a child and the family with regards to the slew of services that are offered, but in a very piecemeal fashion. Thank you, Nico. Dr. The questions are not easy. The three questions that we had mentioned beforehand are extremely complementary. Often we take from one and answer in another. They're intertwined. There's a relation. But the idea is that we come to a certain understanding and a type of a consensus as to how we're going to be changing all those elements, those things that don't work. We have to say things as they are. Let us call a spade a spade. Things are not working. We're being reproached of taking care of children that are underprivileged or vulnerable. Why them and why not us? We hear all sorts of things on this account. We make the decision. There's a choice that is made to take care of vulnerable or children at risk. Let us define what a child at risk is. And access to service is pretty much nil. That's the sad truth. We deal with improper development of the children. There's a lot of sadness. The parents are sad. Learning difficulties that stem from all of this. Post-traumatic stress disorder. I know that we hear this word bandied about way too much, but that's where these children are at. They're in a post-traumatic stress disorder situation, and nobody's really taking care of that. It's as simple as that. There is no one-stop shopping. I don't want to insult psychiatrists, but often these children or this youth are referred to a psychiatrist because they're just not able to follow, and the psychiatrist will say, well, I don't know. If they're depressed, fine, but it's not depressed. It comes back to us. It's the same thing for these children that speak of suicide or have suicide ideations. There is no access. Learning disorders, that's a huge problem in and of itself. You know that there are cutbacks, and now we're cutting on the special needs side of things. So as a society, I don't think we can do any better than that. There are no more services offered in the school. We're trying to do something at the Garage de Musique. We're trying to figure out how we can manage these learning disorders. You've got dyslexia, dysphasia, all sort of dis here, dis there, left, right, and center, and they fall between the cracks. They go to school, and the staff, and this is on a daily basis, they come to us with the school team, quote unquote, that is very proud to tell us that things are working well, there aren't any huge behavioral problems or issues, and that all is well. Except that it's a very specific path to follow, secondary 1, 2, 3, and then there's a trick question. But what school year is he or she in really? And then you say, oh, well, they're finishing their first year, or the second, or the third. And then what are you doing? Where are you going with this? What's going to happen? Are you sure this child is going to succeed? And that's the $6 million question, because obviously there's an obvious failure. And the truth of the matter is, up to the age 15, there's nothing else we can do, because before 15, there's no specific orientation, or there's no idea of a trade or what have you. But Quebec developed itself because there were adults that needed to work, and that's the way it worked. Mentoring for cabinet makers, electricians. So any youth has to wait for age 15. And when you know they're not going to succeed because there's a difficulty in learning, not because of a lack of intelligence. The intelligence is there, they're alert. The emotional intelligence is also extremely powerful. And but the theoretical side of things is not very strong. And it's difficult to change anything at the secondary level. So you have to orient them in a field that is of interest to them and that they manifest this interest. So at age 15, they go and, and at the grocery store, like Metros, what have you, Loblaws. But this is extremely mobilizing for children as a first job. But you know what? It doesn't work. So access doesn't exist for the majority of these children at risk, who unfortunately have a great deal of difficulty in terms of their development and in terms of mobilizing their strength, I would express it that way. And the approach that we've developed is or focuses on many issues simultaneously. It is associated to what we call empathy or any type of closeness. The connection, going back to Jean Clinton's connection. We led an experience at the Garage de Musique. Unfortunately, it would be too long for me to explain the experience, but we did hire 6-7 adolescents that kind of escaped our attention because we're not always successful, but as mentors for the younger crowd. And it was quite incredible what happened. And there's one person in particular that I've been following since age 4, who's now 14, 15 years of age, who was one of our very best. And when I saw him at age 4, he showed me how he would leave his home to go to the convenience store. He would flee from the window, and his mother wouldn't know because she was handicapped and she was on the second floor. She couldn't run after him. She couldn't go down. So he took advantage of the situation. So he's a pre-delinquent, let's say things as they are. And he was, it went pretty well at school, but then a bunch of things happened and he dropped out. And here we have, he'd say things to us like, it's a rebirth. I'm a Renaissance man. My life is going to change. He's gone back to school, etc. And it's thanks to a type of a buddy system, empathy, compassion, reinforcing his strengths. But there's a lack of that. There's a dearth. It exists in social pediatric centers, but elsewhere, no. And this is our strength, and this is what creates our relative success, and that we'll be able to change something within society. But actually, not only is there a lack, but there's an inexistence of this service elsewhere.